Hey guys, Sunny here from Pursuit of Motion Physio. It's Rehab Friday, so this week we thought we would explore the low back region. So chronic low back pain is pretty common in the population, so we wanted to make some comments of what kind of activities to do, how to do it, and what's most beneficial. So the first thing is always to remember to have positive expectations with an exercise program that is shown to improve the results. The second thing is cardiovascular or aerobic exercise is very good for you, so walking, jogging, or doing the bike would be good things, and then resistance training as well. So doing some resistance training along with mobility training, so stretching. So everything combined has the best effect on low back pain. And we're going to go through some exercises next, so see you soon. All right guys, so the first point is aerobic exercise is shown through research to help with chronic low back pain. So doing some walking, some jogging, doing the bike, all good things to do for low back pain. And that first point that I mentioned, to have a positive outlook on rehab or doing things to help your pain, is going to be very important. So if you set your expectations of, hey, I'm going to get better, or things are going to improve with activity, it is shown to actually have better outcomes. So keeping a positive mindset is very important, and activity helps you do that. So yeah, aerobic exercise is great. Alright guys, so we have Olivia here going to be demonstrating a few exercises. We're going to go with the child's pose first for a mobility exercise, so doing a stretch. So very good for the lumbar spine, very comfortable to do. I do this one daily, and it helps quite a bit with my activities. So holding for 30 seconds to a minute. Olivia can also walk over to one side and stretch one side more than the other. So if you find more restrictions on the right side, you can do it like this. She can come to the other side and stretch out the left side a bit more. Getting deep into a nice stretch. Yeah, 30 seconds to a minute on each one, and see how that goes. So we have Livia again demonstrating another exercise. We're going to do a quadratus lumborum stretch, or stretching some of the muscles in the lumbar spine. So she's coming to the side here, and she can push off the wall a little bit to get more of a stretch. She can also rotate her hips to localize the stretch to where you need to feel it, wherever you find the stiffness. And same kind of thing as child's pose, you can hold 30 seconds and doing both sides. So once she finds the stretch, then she locks it in and holds for 30 seconds to a minute. All right, so next is a good morning exercise. So we're gonna go through some resistance exercises to do. So we've covered some cardio, some aerobic training, some stretching, and now we're gonna go into some resistive exercise. So good morning is a really good exercise for your back, for your hamstring, glutes. You could do it with a broomstick. You don't have to start with a barbell. So if you don't have a barbell, don't worry about it. So what's going to happen is you're going to get it on your back, kind of like in a squat position. You're going to bend your knees a little bit, and you're just going to kind of lean forward and then come right back up. So you should feel a pull in your low back and your hamstring and your glutes. For me, all three. So I'm going to do about 7 repetitions and 3 sets. And start from there. Start very light. Don't be putting on weight right away, especially if you've never done them before. But a great lower back exercise to do. So we have Olivia again. We're going to be doing some resistance exercises. So we had the good morning first. Now we're going to move on to plank. So very good core low back exercise. So she's set up that her back is straight. So we're going to go a little bit lower. Right there. So that's going to be your position for a plank. So I typically tell clients to do this until fatigue, or they can't keep that position. So let's say 30 seconds have passed and now Olivia is finding some fatigue and the bottom kind of goes a little bit lower. That would be fatigue, so then she would switch or to take a break. So she would switch to what's the side plank. So another good one to do, focusing on one side more than the other. And again, staying nice and straight, holding that for as long as she can, and when that comes down a little bit, she gets tired, then we switch sides to the other side. So trying to do 3 repetitions per side and doing it until fatigue. Good job.